Now, how do you assess function of the lower back or the lumbar spine? Last week, we talked a little bit about what normal is, defining normal in terms of function of your body, your structure. And we talked about how what we typically think of as like lower back pain or any type of pain that might refer down into your leg, rather than trying to find an exact diagnosis, labeling it a sprain or strain or disc herniation or annular tear or facet syndrome or piriformis syndrome. So rather than giving it a label, which comes with its own kind of limitations, we want to look at the things that we can control. So it's great to name something, but then what are you going to do about it once you've named it? And ultimately, it comes down to function. So we assess function because obviously the pain that we're feeling, it's not, people aren't born with bad backs. They have missing needs, and that pain, that symptom, is a sign of that unmet need. And there's probably many different requirements that your body has in terms of keeping your lower back healthy. Movement, a range of movement, regularity of that movement, that's a good one. Healthy functioning muscular system, so your fitness, your strength, your suppleness, your mobility, that's part of it. But structure, that is a big requirement for a healthy functioning pelvis and lumbar spine as well, and even the pelvic floor as well. So I'll take you through some of the tests that we do to just assess how your pelvis and your lumbar spine, but ultimately your whole structure and nervous system is functioning. And then when we identify dysfunction, we can put a plan in place of restoring that as close to normal as possible. So one of the first tests that we do is a digital structural analysis. So we take a high definition digital image, we look at you from the front and from the side, because everything should be stacked on top of each other. And if you think about your pelvis as the foundation of your spine, if there's an imbalance or a tilt or a twist through the pelvis, there's going to be adaptations further up in the body. We have these special bilateral weight distribution scales, and what they do is they measure how much weight you carry on each leg. We typically do this over a 30-second period, and it measures how you're shifting your weight between your left and your right leg. And we consider normal for that to be within about 5%. So it looks at position, but then this also assesses your nervous system. What it does is it measures how much you're swaying forwards and backwards and left and right. Because when there's dysfunction in the spine, there's dysfunction in the nervous system. And that's how your brain knows where your body is in space. So what we call coordination or clumsiness can just be dysfunction of the nervous system. So have a look. This is the brief one that I just did. So if you come have a look over here, just come around. So this is the report. I just did a quick little 10-second one. And what we're looking at is we're looking at how even that weight is between the left and the right. Now, lucky today, nice and even for myself. This is how I was swaying. I only did this over a 10-second period just now, but typically we do this over 30 seconds. And you want to sway in a symmetrical way. So imagine we put a dot on top of your head and we look at you from the top. This is how I was swaying over that 10 seconds. So you can see I was swaying slightly over towards that right-hand side. Now, this is an indication of a proprioception problem, that my brain and the body aren't quite talking to each other 100%. But this could be quite dramatic. It could be 45 degrees out to the side. It could be completely swaying left and right rather than forwards and backwards. And then lastly, with this test, we also just look at where the pressure is on the feet, where that center of gravity is related to that pressure. And then we go through and we measure, because of these distortions away from normal, how is your body or the surrounding postural muscles having to compensate to help you through your life? So that's what this test is. This is a SEMG test. It's a way of measuring how muscles are working. So a lot of people might have had an ECG, electrocardiogram. So that's the same test, but we're looking at cardiac muscle. This is an EMG, electromyogram. So we look at skeletal muscle, in this case, your postural muscles. And we know what normal is, how much activity there should be in different regions, but we also know that it should be symmetrical within 20%. Now, this is a sample test. Now, this is normal, nice and balanced and symmetrical between the left and the right, and green is a healthy level of muscle activity. So in this example, we can see that there's a big imbalance in that upper half of the spine. And then with that imbalance, we also see these higher levels of activity, purple being medium high, red being significantly higher. And then connected to that, we also just look at how things are functioning and how things are moving. Because, of course, the reason why all these things are abnormal is because there's parts of the spine that aren't moving properly. So we look at how well you're moving, see where the limitations are. And that's actually one of the best indicators to tell us where the problems are. Because where the pain is, isn't always where the problem is. And the important thing about these different tests that we do in the practice is there's no one test that's conclusive. That's why we do a few tests. It's a bit of a puzzle piece to fit together so we can get an idea on where's the body, how is it functioning, how's the spine functioning, how's the nervous system functioning, and then we can make a structured recommendation to help improve that function. Stay tuned in the following weeks. We'll talk a little bit more about some more actionable stuff and that you could do. And we've got lots of shorts coming out this week about action steps that you could do today to help improve or bulletproof the function of your lower back.